I have a interest in helping people who have a relatively fairly common problem. It's called hyperhidrosis of the hands, also known as sweaty hands or sweaty palms. Everyone has encountered, either they may have it to some extent when you get nervous or stressed, everyone's hands sweat a little bit. But there's a segment of the population whose hands sweat excessively, not only in stressful situations, but also often when they're really relaxed in their own home, either playing video games, watching TV, reading a book, and for some reason their emotions are set off, their brain can't control it, and they sweat excessively in their hands, often in their feet and sometimes in their armpits simultaneously. I'm involved in the surgical remedy for this, and it's called endoscopic thoracic sympathectomy. There were operations that could reverse sweating and control it, but they were relatively invasive. So they weren't really applied terribly frequently. And about 25 years ago, with the advent of minimally invasive surgery or thoracoscopy and laparoscopy, which facilitated surgeons being able to access body cavities, be it the abdomen, the chest, through very tiny incisions. So that sort of opened up a whole new opportunity to apply operations to individuals which weren't traditionally very well accepted or known about because of the invasiveness. Now being non-invasive, they could be applied with a lot less side effects, so patients would benefit from a procedure but not suffer any of the side effects of large incisions, painful incisions, etc. I started performing ETS about 1995 and became a leader in the field in this area and in the world, and have contributed to the development and advancement of this procedure. And over the years, we've helped thousands of people who suffer from this problem by allowing them to undergo this minimally invasive operation, which completely eliminates sweaty hands. And for people who suffer from this problem, it's really a life-changing event. They have the procedure, it's done under general anesthesia, it takes about an hour, they go home the same day, they're back at work within 24 to 48 hours, and from the time they wake up from the anesthetic, the sweating in their hands is gone, and they can do everything that they've always wanted to do without being embarrassed, by the problem of excess sweaty hands. So for people who have this severe problem, it's really a life-changing event, and we're happy that we can offer this to people who have this problem.